Hi, my name is Shay Reitler, and I will be doing the IV push medication and the IV discontinuation. So first, I'm going to wash my hands, and I'm going to go into the med room and check my MAR. And we're going to see that we're going to discontinue the IV infusion after the last dose of clavurin, so we'll discontinue their continuous medications. So I'll start with that, and then I'll come back and get my other med drawn up. I'm gonna come into my patient's room, introduce myself, hand hygiene, patient name, date of birth, verify I got my right patient, we're discontinuing the right medication at the right time, right dose, right route, and then we'll do the right documentation. So first, I'm just going to explain this to the patient that we're going to discontinue the continuous medications, but we are going to leave you with your saline lock on. So first, I'm going to get a piece of gauze, put it right under my hub, and we're going to clamp this so the infusion is completely stopped. We got our 5 milliliters of sodium chloride flush. We're going to discontinue the continuous. And I'm going to wipe the port, and we'll inject that 5 ml. We're just going to make sure the IV line is still patent, still good to use. Take this off. Check for any swelling, redness, pain, edema at the site. You can dispose of these, and we'll dispose properly of our IV medication, making sure no patient information or anything like that is on there when you toss the bag. And after that, we're just going to do some education with our patient and explain that we're leaving you saline locked so we can still access if we need to give you any meds or anything in there that are not continuous, like the IV or like the like your normal saline was. And then just make sure they're comfortable, have their call light, ask if they need anything, let them know I'll be back. We have a medication to give, and I'm just going to go get that prepared. So I'm going to go back to my med room, wash my hands, check my orders. So we have give Dilaudid 2 milligrams IVSP every 2 hours is needed for complaint of pain related to coughing. Dilaudid label states Dilaudid 2 milligrams per milliliter and dilute with 2 milliliter normal saline for IV administration. Give Dilaudid 1 milligram every 2 minutes per IVSP. So when I look at my orders, I'm making sure I do have the right patient, we got the right meds, right dose, right route, right time. And before I go into my next med, I'm going to document discontinuing the continuous infusion, and I would put how the patient reacted. And I would also put that I flushed with 5 milliliters after discontinuation of the normal saline. So now that we are looking at our next med and we did our checks, we're also going to do the 3 med checks. So we're checking the med before we take it out, after we take it out, and again at the bedside. So we need some Dilaudid, and then we also need the normal saline to dilute it with. So after I have all my supplies, we have syringe, got my gauze, and then after we give this medication, we are also going to discontinue the IV. So I'm going to go back to my patient's room. I have all my supplies, wash my hands, introduce myself again, get the name, date of birth, make sure we have, we're going to do our 3rd check here at the bedside, making sure we have the right med, and making sure you have the right patient, right dose, right route, right time. And we're gonna check allergies, which they just have latex and penicillin, so we don't have to worry about that. And we're gonna explain the doctor prescribed Dilaudid to help. It's an antitussive to help with your coughing from your bronchial pneumonia. And so first, we can draw up our solution here. So I'm gonna take my caps off. And get our syringe. And we're going to pull up 3 milliliters total. We're going to get 1 milliliter of Dilaudid and then add 2 of normal saline. So we'll do our Dilaudid first. We're doing 1 milliliter. And then we're going to get our normal saline. And that was 2. I'm just going to get any air bubbles out. Okay. Just going to scoop our needles back on. We'll take this needle off, putting it in our sharps. So next, we are going to wipe off our port and flush with 5 milliliters normal saline, our flush. Just making sure that line is still patent and taking fluids. There's no obstruction. We're just going to clean off that port again. And now we can do our medication. And Dilaudid you want to administer over about 3 to 4 minutes. So it is a little slow. Make sure you're not pushing it too fast. That can cause a reaction. So yeah, just maintaining a very slow pace. And at this time, you can be talking to your patient, making sure they're doing okay. Okay, and then after your 3 to 4 minutes, you're gonna remove your syringe, dispose of it. You're gonna clean that port again and do another 5 milliliter flush, just to assure all that medication gets in there. So we'll just do 5 milliliters. Making sure that line is still patent. We can remove that. And then after giving your medication, just assessing pain, assessing that IV site again for any swelling, redness, pain, anything like that, asking your patient how they're doing, making sure they're doing okay. And then our next order was to discontinue the IV. So for that, we're gonna, well, first we're gonna document that we gave the Dilaudid, document the reaction that the patient gave, and then reassess later and see if it helped with that cough. So to remove an IV, we are going to put this here. So I'm going to wash my hands. We're going to explain to the patient there's no longer a need to give intravenous medications or solutions. So we're going to go ahead and remove that. So I'm going to put on some gloves. Make sure you're assessing the site before and after discontinuation. So I'm just going to start by taking off my tape and making sure this the catheter is staying in place. You're not tugging it in and out or anything like that. Okay, and once you got all your tape down, you're gonna hold pressure on the catheter, hold pressure down, you're gonna pull it out, and you're gonna make sure that your whole catheter is still intact. You'd wanna report if there was any missing or if it looked damaged or anything. We're just gonna apply some pressure for 2 to 3 minutes. If there's blood, make sure cleaning up the site and then maintaining your pressure. And this is my last little piece of gauze. So I'm going to pretend, and then after this you would put on a dressing. So I'm going to put this on and secure it. You can keep that on for a little while so it keeps some pressure on there. We'll throw this away. And then afterwards, just assess your patient. How are they doing? How well did they react or take to the taking out the IV? And how does the site look after discontinuation? And I'll document all that afterwards. And then just making sure your patient is in a comfortable position. They have their call light, beds down all the way. Ask them if they need anything else or have any questions. And that's it. Thank you.